Okay, this video is regarding the Doctor's Data Comprehensive Stool Analysis Collection by Optimal Health Spectrums. So let's get right into it. You were ordered to complete this test. Make sure that you verify everything is in there. Boom, boom, boom. Perfect. All right. So this is going to say the same thing. Make sure you verify all contents are in here, and it does have a list of everything that should be in here, which is especially these directions here. Very helpful information besides this video. The paperwork required, a little capture basket, a few bags here connected with a rubber band. It could be the same collection, just two separate tubes, ice pack, FedEx bag, and prepaid label. So looks like everything's here. We are ready to get started. What you want to do is make sure that you read all of these directions very carefully prior to collecting. I'm going to try to zoom through this for you with all the information to get you prepared as well. You want to familiarize yourself. If you're taking antifungal or antibiotic medications, please finish that course of medication and then wait 3 days before starting this collection. Please also refrain from taking digestive enzymes, laxatives, antacids, aspirin, and substances containing barium or bismuth for 2 days prior to and during the collection of the specimen, unless otherwise instructed by your physician. So whoever ordered this test to be completed for you, you can go ahead and ask that provider who ordered it whether or not they want you to completely adhere to these directions or not. Normally they do unless they tell you otherwise in that appointment, but if you're unsure, let us know. Also, if you are taking any sort of probiotic supplements, you need to refrain from taking that 2 weeks prior, 2 whole weeks before collecting for the test, unless otherwise stated by the provider. So you can definitely ask us about that as well. If you're one of the patients who was ordered to complete a stool test and start probiotics at your appointment, complete the stool test first and then start your probiotics. Make sure you do that, or else it will show us the probiotics in the test results, and we want to see what's going on, not what you are taking. So once you have made sure you adhere to these little rules here, had any questions answered regarding them, you can go ahead and get started. So what you will do is you want a clean catch. So you want a stool specimen with no toilet water, no urine, and no toilet bowl contamination. So if you can, try to catch it with this. Some patients will turn the water off in the toilet and make sure it's completely empty, put saran wrap down, and they'll try to catch it that way. Just try to make sure that it does not get contaminated in any way if possible. So once you have a clean catch, you'll be able to get started. So I will work through that with you right now. Let me get an example. For the sake of this video, I'm using oatmeal, so you don't have to worry about me using real stool on this video. So say that we have a stool specimen here ready to go. What you're going to do is get both of these bags out and the ice pack. So let's start with this one first. This particular vial has information here. Actually, all vials have this information here, so it should always be filled out right before you put the stool specimen in there, your name information, so that they can process it. And then you want to indicate on here what your stool specimen is the consistency of it. So there's a fully solid, semi-solid, really runny, or complete diarrhea liquid stool. So indicate what it is when you see it. And then you can start to collect. You will see that this bag has a glove in it to keep it all clean here. So what you'll do is unscrew this cap here, and you'll notice that there is a little spoon on there to help scoop. You want to pick up and put into here until it is at the fill line here. So you can see it says fill line, and that is that red line there. you want this preservative liquid to go up to that line. So, scoop from multiple areas and drop it into the tube. As you may see at this point, it is at the fill line, so you should be good to go. Don't want to overfill this or else you can't shake it up, and that is what we're doing next here. So close this very tightly, make sure it is secure, and then you're going to shake it up to get the preservative all over that stool specimen. Once that's done, you can put it here in the bag with the paper in case there's any spillage. Hopefully there's not. And this can go right back in the box. The other tube needs to be collected at the same time, so keep your glove on. Unscrew that cap there, and you can scoop into here. So you'll notice with this one that there is no fluid in there, there's no preservative, and that is because the white capped vials need to be frozen. They don't have preservative because they will be frozen. So you will need more specimen. You need to fill it up to that same fill line, but this is all stool specimens, so keep scooping until you get there. Alright, that looks good. Set the fill line there. So you can put that on there tightly. Make sure your indications are already done. If not, do it now if possible. It's a lot cleaner if you do it before, but as long as it's on there, they'll be happy. So this one you can wrap in here, into the paper, and drop it into the bag. Close that up. Using the the ice pack that was in the box, you can put it in this little back pocket here on the bag. And you want to throw this in the freezer until you are ready to ship. Whatever's remaining, you can dump it in the toilet and flush it, or you can just throw the whole thing away. You are all done with that. Done with the glove. Now, last step, you want to fill out the paperwork here. So you will fill out the final sample collected, which would be the day you collected here. Your personal information, so name, date of birth, address, phone number, especially in case they have questions, etc. And then the last thing here is payment information. This particular test is $215, and you will either include a check or you can put credit card information here. So that is our contracted rate with Doctor's Data. We avoid trying to go through insurance only because insurance usually doesn't cover these type of specialty tests, and then they will bump this price up if they try to bill your insurance. So we just avoid it altogether. Whether or not you have Medicare, please complete the back as well. They do require that to be completed and signed. So that's all done. There is a little booklet, like I said before, that has all of these directions in there. So in case you have any questions, you can refer back to your directions here. And you'll see that they actually have little diagrams, if you will, inside. No pictures. The back goes over the shipping instructions. You want to have FedEx pick this up. Do not use a FedEx drop box. So you will call the FedEx number, 1-800-238-5355 to schedule the pickup. You will say rep, and if you're calling to ship a package, say yes. You'll be connected directly to a representative. Tell them that you need a pickup for a shipment using prepaid billable stamp and give your address. They should have someone come pick it up Monday through Friday. If you happen to collect this test over the weekend, you can keep this in the box in the refrigerator until you're ready to ship the following Monday. Just continue to keep this in the freezer until you're ready to ship. Once you know that they are coming to pick it up, you can pull this bag out of the freezer and put it in the box with the other, so it's all together. Paperwork goes right on top. Make sure your information's on there. Close it all up. You will put the entire box into the FedEx bag. you will take the adhesive off here, or the protection, to get it stuck together, which is how you want it. Alright, good. Last thing you do is slap the little billable stamp on here. You want to keep everything else attached to it for your record. So this is yours to keep. And then this goes right here on the center of the package. Once the driver comes up, just give them the whole bag, and it'll be directly on transit to be processed. Doctor's Data will process this information and send our ordering provider the results so they can interpret them at your next appointment. If you have any questions regarding the collection of this test, please call Doctor's Data at 1-800-323-2784. That's 1-800-323-2784. They have amazing people there that will answer any questions that you have. If they can't answer your question and you're unsure, you could definitely give Optimal Health Spectrums a call.